Now is the response coordinator for the White House Coronavirus Task Force. It's Dr. Deborah Birx. Dr. Birx, welcome to Meet the Press. We'll try to close the gap on a bit of our satellite delay and start with the first question this way. It took from February 29th to March 17th to get to 100 deaths. It took another 9 days to get to 1,000 deaths. Sadly, it took 72 hours to get to 2,000 deaths. Dr. Birx, where are we today? And where is this headed in the next few weeks?
Well, this is the way pandemics work, and that's why we all are deeply concerned and why we've been raising the alert in all metro areas and in all states. No state, no metro area will be spared. And the sooner we react and the sooner the states and the metro areas react and ensure that they've put in full mitigation, at the same time understanding exactly what their hospitals need, then we'll be able to move forward together and protect the most Americans. There's a new website up. It comes from Chris Murray out in Washington State. It's on the IME website, IMHE website. It predicts and looks at this built as an infectious disease model.
I would love to take a look at that. What part of this model, what is it telling you, and what does this mean? I mean, what is it that you've learned from that model that tells us, you just said no metro area is spared, so that does tell me that this idea of creating a county by county low, medium, high risk advisory level by the middle of the week, is that something that's not going to happen?
No, I think those two pieces come together. There's two pieces that we absolutely need, and I think you've had many experts talking about this. One of them is ensuring that we have full capacity for full diagnosis. And so that is still going on, and we do have enough tests for that. The other piece of this is surveillance. So we're looking across the United States for counties that do have lower case numbers right now, to see what we can do right now in order to really put into place full surveillance, full contact tracing, and full diagnostic capacity to ensure that cases are found and we contact trace, while the metros and other areas go through clearly important mitigation efforts to spare as many American lives as possible.
What are you seeing in New York that raises alarm bells to you when suddenly Detroit, New Orleans, Chicago start to see the same incoming to their ICU units that the New York area is seeing now?
Well, we're studying New York very carefully. We're studying the hospital needs, how to do better testing, how to keep less sick people away from the hospital and being tested elsewhere, looking at admissions, looking at how to keep those hospitals stocked. It's not enough for us to get materials to warehouses. We have to be working with the state and local governments comprehensively to ensure that equipment and supplies are getting to each hospital. Hospitals are so busy taking care of the people who are ill, they can't be spending time doing inventory, and so we need to help and support that.
Well, that appears to actually be a problem, and I'm curious, what role do you play in deciding where spare ventilators go versus the role FEMA plays? And the reason I ask that is there seems to be some confusion. Governors are complaining that they find themselves either bidding against other states or the federal government when it comes to different equipment issues. So is the federal government going to take over all procurement and disbursement of medical equipment or not?
I think at this moment we're asking every single governor and every single mayor to prepare like New York is preparing now. Know where every hospital is, public, private. Know where every one of your surgical centers are. That's where your anesthesia ventilators are. Know how to change those anesthesia ventilators up to supportive ventilators to take care of people. Know where every piece of equipment is in the state. Know how to move that around the state based on need. The one thing that we can do as Americans is we know how to innovate. So it's not just what you have inside your doors today. It's how you can surge and move things around. We know this epidemic moves in waves. Each city will have its own epidemic curve, and so we can move between states, we can move within states to meet the needs of everyone.
You sort of overlooked the question, though, about is the federal government going to take over at least the procurement and the distribution of things going forward? I understand what you're saying. States and mayors need to do right now in case they don't have this from the government, but who should be trying to acquire new equipment, states or the federal government?
Well, I think the federal government right now is working very hard on looking at where all the ventilators are and where production can be. But we need states at the same time to look where all of their ventilators are, including outpatient surgical center, which is a really important place to be looking because you get staff plus ventilator. They have also the clearly the cardiac monitoring, the able to monitor oxygen levels. All of that can come into the hospitals to care for patients. So both of those pieces need to come together. The government looking to increase procurements and states looking for every single option that they have.
New York City, if you could quarantine the tri-state area, and there's a lot of legal hurdles to that, if you could, do you think it would be the best way to slow this virus down?
When we looked at what New York State and what the mayor and governor did over the last 10 days, when those alerts went out of the increased number of infections, a lot of people who could leave New York left New York. And so we immediately saw cases rising out on Long Island and cases rising in southern Florida. What we're trying to say to everyone is when this virus comes to your metro area, please stay in your metro area where your care can be provided because it's spreading virus more quickly around the United States.
Should we be shutting down domestic air travel? I understand you need to move airplanes for supplies, for people in necessary environments, but should there be some domestic air travel shut down? I mean, it does seem odd that New York City airports are wide open for people to leave.
The amazing thing to me and what has been so heartening to me, and when I work on epidemics around the globe, it's seeing communities come together. And communities have self-quarantined and self-isolated themselves. The amount of air travel in and out of New York, we believe, is down by 90%, Metro down by more than 90%. Okay. So people are using common sense to protect others. We also have to be able to move doctors and nurses around the United States. They're part of our surge capacity. You can see many have come forward as volunteers, and we need to be able to get them places.
Are you going to announce the new guideline? Given everything you've just said, given that no metro area is going to be spared at this point right now, that's your concern, should we assume these 15-day guidelines are going to get extended another 15 days, another through the end of April? What's realistic, Dr. Birx?
What I wanted to be very clear on is every metro area should assume that they could have an outbreak equivalent to New York and do everything right now to prevent it. If they mitigate now, before they start seeing cases in the emergency room and in the hospital, once you see those, the virus has been spreading for days to weeks. So this is really my call on every mayor to prepare now.
So it sounds like these guidelines are going to be extended at least another couple of weeks. Is that fair? As Americans are watching, should they be prepared to be hunkering down for the rest of April?
My job today is to put all the data together, the integrated data of testing, case reporting, the global situation, and prepare the best briefing I can for the president and vice president so they have all the data to make the decision that's best for the American people.
So are you going to, what is your recommendation? What recommendation are you going to be giving to them, or are you not sharing that with us?
I'm going to share it with the president and vice president first.
All right, Dr. Birx, I will leave it there. Stay safe, stay healthy, and we all want to defeat this thing as soon as possible. So thanks for your service.
Thank you.
Hello from Washington, I'm Chuck Todd, and thanks for checking out the Meet the Press channel on YouTube. Click on the button down here to subscribe and click over here to watch the latest interviews, highlights, and other digital exclusives.